Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Jenni Johnson, the founder of Jenni Johnson Breast, Bottle, and Beyond. Jenni is a registered nurse, an international board-certified lactation consultant, and a craniosacral body worker with a passion for helping families navigate breastfeeding, bottle feeding, pumping, weaning, and everything in between. Jenni is especially passionate about addressing birth trauma and body tension, tongue and lip ties, helping women get the most out of pumping, and ensuring that families truly receive the support they need to meet their feeding goals. She is such a blessing to families in Northeast Wisconsin as she offers in-office support in Green Bay, Appleton, and Antigo, as well as mobile support where she'll come to your home. Outside of her work, Jenni loves to travel, read, and sing, plus she's been married to her high school sweetheart for nearly 35 years. We can't wait for you to learn from her, so let's get started with today's conversation. Hello, everyone. Welcome back to the Motherhood Alliance podcast. We are in episode number 4 with Jenni Johnson, a local IBCLC, and we are just so thankful for all of your knowledge, Jenni, that you've shared in our first 3 episodes. Welcome back.
Thank you. It's been fun.
It has been fun. And in this episode, we're going to be jumping into some very unique topics. So induced lactation, relactation, post-surgery breastfeeding, what's possible with all of these. And so I think it'd be great if we could just start out with kind of defining each one of those and giving maybe a circumstance where you might see this type of journey.
Okay. So induction and relactation are similar. They kind of go together. Induction of lactation is generally for a family that hasn't birthed a baby. They haven't gone through that space of carrying a child and having lactation happen spontaneously after delivery. It can be used, though, as well for someone who has fed their children in the past and decides now that maybe through adoption or providing donor milk or something on that order that they want to reproduce milk. Generally, it's not within that period of postpartum.
Okay.
Relactation is kind of in the period of postpartum. Maybe things were really tough at first. We didn't get the help that we wanted. Then we found Jenni and we're like, hey, I think I want to try this again. So that relactation is typically in that space of being in your postpartum period yet, and then deciding that we want to reproduce milk.
And on that note, just a quick question is, if a woman has the baby and naturally has milk produced and then chooses to kind of hit pause, right? How long does that milk stay in the breast?
Everyone's a little different. Many times our moms, even that miscarry, will have milk for like up to 6 weeks.
Oh, okay.
Yeah.
Okay.
So it can stay in the breast for quite a while. Again, everyone's different, but most people about 6 weeks or so. That initial postpartum period.
And then the surgery option. Now, this could be, we're going to be talking about surgery in general, if you needed a surgery on your foot or your hand or, your gallbladder or something like that, but also breast-related surgeries.
Yeah. So augmentation and reduction. So anything that we do surgery in the breast area, even biopsies, if someone's had some major biopsy work done, it can cause some nerve damage. It can shift tissue. A major breast reduction actually they'll remove your nipple, set it aside, and then reattach it.
I did not realize
Our
that.
eyeballs just got really big in here.
So most moms that have had a breast reduction will have what we call a keyhole incision. The incision goes from like their rib cage from under up around the nipple and then back down. The nipple is set aside. The wedge of tissue is taken from underneath the breast, brought together, and then the nipple is reattached. So the longer the time is between the surgery and feeding, the more likely we are to have reattachment of nerves.
Wow. This
That's
is already
amazing
mind-blowing.
what the body can do to heal itself too.
Mm-hmm.
Wow.
Yeah.
Okay.
Yeah.
I'm excited to hear about that too. Yeah.
For all of these situations, and really in general, when a woman gets pregnant, I'm assuming there's hormones that are changing. That's going to be impacting milk production. But for any of these situations, what actually triggers milk production in the first place?
So during pregnancy, we see a rise in the progesterone and the estrogen, and that actually drops when the placenta is detached. And with that drop, it signals the body then to go into lactogenesis 2 to start producing that milk. So initially, at about 16 weeks, your body will produce colostrum, and many moms will leak that or be able to hand express some of that if they want to harvest that for their babies. And then at delivery, we see that drop in hormone and the shift to then lactogenesis 2.
Okay. So it's all hormone based.
All hormone based. So if there's a hiccup in there, that domino doesn't happen in the right sequence, we can have milk issues.
Okay.
Oh, interesting.
So
yeah.
let's start with relactation, because I feel like that one's the easiest for me to wrap my head around here, right? Like this would be a woman who lactated, chose to kind of hit pause for a period of time, and now wants to boost her supply again. So what would be kind of the first steps for somebody in the relactation?
So we always want to take that step back, and why did we stop? What paused? Was it latching issues? Was it support people? Like, did the family just make you feel like a bottle of formula would be better? So we want to explore that a little bit so that we understand the emotional aspect of it as well. If it was latching, if it was, baby wasn't feeding really great, well, we want to explore that because it doesn't help her if the baby's still not going to latch. Right. So we want to figure out what happened. Pumping is a great way to kind of reestablish a milk supply. It's a little bit more controlled. Some people like to have the numbers like we talked about earlier. You want to see volume. We want to see those things that we can write down and track. So we would start with stimulation of the breast. We want to increase those hormones again. If a baby wasn't latching, even going skin to skin with them, having them snuggle in on that bare chest can help stimulate some of those hormone exchanges again too.
How long would it normally take to kind of start seeing a decent amount of milk production again?
It depends again on why and how we stopped, but generally within a few weeks, we should start to see milk. We may never get to a full supply, but having some milk is always better than having no human milk. I worked with a woman, actually my first relactation episode was when I was working at the hospital, and she wasn't even a patient that delivered by us. She was a friend of one of our nurses' daughters.
Oh,
and it was like, I have this friend. My daughter has this friend that had a liver transplant and was told she couldn't breastfeed because of the medications, anti-rejection medications and things that she was on. And so she never tried to latch the baby. Milk naturally came in and then went away. And they could not find a formula that would settle the baby. He was just very irritated by formula in general. So she wondered, what if I gave him some milk? What if I, had milk that I could give him? So it had been 4 months since she had delivered and never released any milk. And we sat down with the medications and mother's milk book back then and went through her meds, and I encouraged her to contact her team. I said, I don't see a contraindicated medication for breastfeeding. I'm not sure why they told you that, but there wasn't a reason that you couldn't.
Ooh, I bet she wasn't too happy about that.
She was a little disgruntled, yes. Yeah, there were some emotions in that space as well.
Yeah.
So she started with some pumping and kind of doing the skin to skin and snuggling. She was able to get him to latch, which was great. Sometimes we don't get babies to latch, especially if they've never latched before. And she never got a full supply, maybe about a ½ ounce to an ounce a day. But he tolerated the formula better by having some of that human milk in his belly. And they recaptured some like nighttime snuggly feeds and some time that way too.
Yeah, and that's really helpful to just walk through it as type of situation someone might be in. So that's a more medical reason for hitting pause, right? So if a woman is going into surgery, and this could be general surgery or breast surgery, like what should she be doing ahead of time? Should she be trying to decrease her supply? Anything else to consider as she's getting ready, and then how to ramp it back up after?
So if a mom is having general surgery, having her gallbladder out, having her appendix out, those seem to be our two big surgeries after delivery. For some reason, postpartum agitates those gallbladders and those appendixes. So we see a lot of that. Or wrist surgery, hand surgery, something like that. We would actually encourage her to increase her supply a little bit and maybe build that little freezer stash that we weren't so sure we wanted earlier, just so that we have some backup milk. That way, when she's in the hospital, someone else can feed the baby. We would definitely look at medications if we can find out ahead of time, like if there's a specific antibiotic that she's going to be on. Maybe, the surgeon has their favorite, but we can use an alternative that isn't as impactful. Maybe we can do that and decrease the time of wasting any milk. There are very few contraindicated medications with breastfeeding. The body does a really good job filtering and protecting the baby against things that mom may come in contact to in the environment. So, like we talked about earlier, anesthesia is not a reason to pump and dump. A general X-ray is not a reason to pump and dump. Only if they are using an iodine or radioactive dye are the times that we want to pump and dump that milk so that it's not affecting baby at all. But then we want mom prepared going into the hospital. Does she want to take her double pump? Does she want to use her manual pump? How soon after can she feel comfortable and confident removing milk again? During COVID, we struggled because baby could not come to the hospital to feed. So if mom is stable, she's not in ICU, she's not in a space, in that she's really incapacitated, we can actually have baby come to the hospital and she can feed the baby there too.
Okay, that is really helpful to just understand. Is there a resource that you use to help, is there a website that people could go to if they want to understand what medications are kind of limiting their breastfeeding? So
the Infant Risk Center, Dr. Hale worked with the Infant Risk Center until recently he retired, and they are a fantastic resource. You can check by medication. You can actually call them. They will look through medications and help you kind of make those decisions as well.
Okay.
That's fantastic.
Right. Yeah. And then let's talk about the actual breast reduction type surgery, because that's going to be, that's a little different.
Yeah. And reduction versus augmentation, there's a difference.
There is, but they both can impact.
Yes.
So augmentation is usually having implants put in to augment or change the way that your breast looks. Understanding why mom had that surgery done to begin with is super helpful, because there's some types of breast tissue, the hypoplastic breast comes to mind, where maybe one breast is full and round and the other one's more peaked, or they're just very misshapen, or never really fulled into that full rounded breast during puberty. There may be hormonal issues going on that we don't get a great milk supply. I worked with a client when I worked at the dental office. She came in and she really, really, really wanted to breastfeed. And as a part of our evaluation, we did a feeding prior so I could see how baby was feeding. And as soon as the woman opened her blouse, I knew that she was struggling. And it's never an easy conversation. So as gently as possible, I asked her if anyone mentioned that the way her breasts had developed, that it may impact her milk. And she said, no, nobody's ever mentioned my breasts. And she had double hypoplastic breasts, very little growth of the breast tissue itself. The nipple area was very bulbous and rounded, and she really wasn't producing any milk. And I felt terrible that here they were at like the 3-month mark and no one had helped her that in depth to actually take the time to look at her breast. And she was so grateful to have the conversation. And we have options at that point. Maybe we don't make milk, but we can use donor milk or formula with a supplemental nursing system, and she can still have contact feeding. But she was just devastated that no one had taken that time to do a breast exam and really look into why she wasn't producing enough milk for her baby.
Yeah.
And then too made to feel like it was all her fault and it was nothing she had control over. So we want to dig into why mom had a breast augmentation. If like I had another patient that had a reduction because she had lost a lot of weight and her breast was very saggy, and the provider doing her reduction surgery never said to her that I may damage and remove some of your milk producing cells. We need the hormone stimulation at the nipple to trigger the oxytocin in the brain to then trigger the release of the milk from the breast. So if we don't have that pathway, we're not going to drain the breast well either. So, we struggled to get some milk. She had some, but she never had a full supply either.
What about the nerve damage that happens from any sort of surgery?
Again, that whole cascade. So if we're not getting stimulation to the brain to tell the brain that there is something at the breast that needs to have the milk removed, and then that coming back down, we don't get the release. People call it letdown, and I get frustrated because to me that sounds like a letdown.
Like, oh man.
Exactly. So I prefer milk ejection. You've probably noticed a couple terms I've kind of tweaked as we've gone through. Like I talk about human milk, not breast milk. I talk about milk ejection, not letdown, because I'm like, man, breastfeeding is a letdown sometimes. We don't need to make it worse. But if we aren't triggering the little muscles around the alveoli to squeeze the milk out of the breast, it can come out some by vacuum, but it kind of needs that back pressure to help really get that milk out. So an augmentation generally severs some nerves as it is shoved in and up into the breast. And then the whole removal of the nipple during a reduction surgery can really impact. Now, that being said, I've had moms with reductions that have had full milk supplies. It can happen. It's just getting that help early and having someone follow you and continue that care to make sure that things are going the way we want them to.
Is there especially with reduction, is there a way the surgery can be done to help make it so there's not as much damage? Or is it just generally it is what it is?
It generally is what it is. I'm hoping over time we can figure it out, because there are women that cannot avoid. I mean, they've got J-cup breasts and their backs are curving and they need to have some tissue removed. I don't think that we've had the conscious input of how to do it better. It's kind of like, this is how we do it.
Sure. Yeah.
And let's circle back to the induced lactation. So this is someone who has not had any sort of history of, well, they may have a history of it, like you said, but it's somebody who did not birth the baby that they're going to feed. So this is like starting at ground zero.
Correct.
How do you even start?
So we start with stimulation, and we start with kind of breast massage and suckling, and it may be partner suckling. It may just be getting those hormones moving again. And then if the parent is willing, they can do a hormone replacement kind of thing. So just like we would have a drop in the estrogen and progesterone, we can give people synthetic hormone and get that drop. So it may mimic like a miscarriage or a delivery. So generally it's about 3 to 6 months or so. So we want to start well ahead of time, if that's something that you want to do. And then 6 weeks before baby's arrival, then we're really going to get earnest about pumping and really getting into a schedule. And we can start saving all of that milk so that maybe if we don't have enough initially when baby's here, we have some stored milk also. And again, too, if milk isn't present when baby arrives, because sometimes we plan, right? You make a plan and it changes. Some parents think, okay, we're on the list and we're going to get a baby in 6 months and this is our trajectory. And then a baby gets dropped off at the fire department and all of a sudden they're like, hey, we have this baby and are you willing? And you're like, yeah, I'll do this.
Yeah.
So then we can do, again, the supplemental nursing system at breast. We can use donor milk or we can use formula to help feed baby and then continue with that bonding.
I just think it's so cool that even like an adoptive parent could breastfeed their baby.
Mm-hmm.
Yeah.
How special is that?
It is so special. And sometimes too, it's happened in families of loss.
Yeah.
A mother dies in childbirth and a sister then relactates or induces lactation to help feed that child.
Oh,
Wow.
man. I want to get teary-eyed for that one. Oh, my gosh.
Well, and I also think about a lot of these situations can be very stressful for the parents. And so how does stress impact lactation?
Stress is a huge dampening to lactation. And that's part of, like, I have a special induction and relactation visit that we go through some of that history. We talk about the stress. We talk about, motivation. We talk about things because it can impact so much. Cortisol is a hormone that we release while we're stressed and can actually dampen your oxytocin release. So stress in general impacts milk release. If you think about it like the fight or flight, if you're being chased by a bear, you don't have time to stop to poop or pee. You're going to keep running. Well, we don't have time to birth and we don't have time to release milk either. It's all in that same space. So any stress can impact that milk release. So trying to help parents find that space of, I don't want to sound strange, but like serenity. I use a lot of conditioning and guided thoughts and things like deep breathing. We hold tension as we inhale, release it as we exhale. Finding a space like your favorite music, finding a space, like a funny show. Laughing releases endorphins, helps with the oxytocin. So helping parents kind of navigate that anxiety and stress can be super important as well.
Mm-hmm. And I feel like you even talked about in one of our prior episodes how you're just a laid back person. And I feel like people can hear it in your voice, just how much you like care about their journeys and how you just want to help them through it. And so I'm so thankful that you're a resource in our area. I think I'd love to end this episode with kind of a general tip for anyone who is in the breastfeeding space right now, whether they've gone through one of these things that we talked about in this episode, or they're just, they birthed their own baby and they've been feeding. What are some general tips for boosting supply for anyone?
So one is relaxation and motivation, right? Don't totally A-type stress yourself out. We want you to be as relaxed as possible. The best way to make more milk is to remove more milk. So if we're feeding, we want to make sure that we have an optimal latch. We want to make sure that baby is draining the breast effectively. Oral restrictions and body tension can cause fatigue, and they can eat very frequently for small amounts because they can't pull it together to feed longer. If we're pumping, we want to make sure that our flanges are fitting well. We want to make sure that we're in a space and schedule that really works well for us. I worked with a mom one time. She was the only engineer in an all-men's office, and she knew when her pump was running, they could hear it. Simple change. She put earbuds in. I said to her, listen to music. And it was kind of like, okay, what can we try? Let's see what else. I'm like, if you don't hear the pump, they don't hear the pump. And it worked. So it got her, to that space where she was able to remove more milk. If I had a magic pill, if I had a magic combination of supplements and whatever, and I gave it to you, it doesn't matter if you're not going to remove the milk. We have to get the milk out of that tissue to help reproduce it. Your body rapidly reproduces milk in about an hour. You have enough for a feeding in about an hour. So if we need to, we do some frequent pumping. We do some frequent feedings. We do some things to get that moving. If we're not getting what we want in the next week or so, that we're seeing some increase, then I like to go to foods. I like to do, again, cheap and lazy. I like to use what's in your cabinet. High fiber, high protein foods are really your best. If I hear one more person sell an oatmeal cookie, I'm going to scream.
Oh.
Oatmeal is not our only form of fiber, and it's best if it's closer to steel cut than processed.
Sure.
So when I've got a mom's like, well, I eat 3 bowls of instant oatmeal every day, it's probably not giving you the fiber that you're hoping. So we look at our whole grains, rice, quinoa, barley, if you can manage that with, any, that's a whole nother, like, if you're gluten intolerant, like we have to have a whole nother discussion.
Right.
And then your pitted fruits are my favorites. So anything with a pit, a nectarine, a peach, an apricot, and a plum, and then their counterparts. So, the plums are prunes.
Prunes, yes.
Like, I can see them, I can't say it. So those are great fiber sources. And then your proteins, the leaner, the better. They say fowl, turkey, chicken are the best. And your wild protein sources, so elk, venison, bison, have a little bit higher protein. If you're meat eating, we can do nut butters, we can do things like that as well, your beans and your legumes to get that in as well. And then too, some of those, you get your iron, you get your fiber, you get your protein, so we can really do that well. And then hydration. We need to have fluid to make fluid. The milk-producing cells in the breast are actually like a mucous membrane, and we need to keep that hydrated to help keep that milk flowing. If those things aren't working, I do move into the herbal supplements, but that's really dependent on why we're struggling. So if a mom has like gestational diabetes or insulin resistance, then maybe a goat's roux is going to be our space. So we really want to know, again, more of the history and why we're struggling with our milk production versus just blanket covering everything.
Right. And that's the reason why you should be working with somebody who specializes in this, because it's very individually based.
Absolutely.
Awesome. That was a great list. Go ahead and rewind and listen to that again. And to finish out all 4 of our episodes together, really quick, what does the future hold for Jenni Johnson Breast Bottle and beyond?
I would love to have access to helping more moms in that pregnancy phase. I feel like education is the key to building confident parents. I feel like we need to look at all infant feeding, not just feeding at the body, but we need to do a better job with feeding our bottle-fed babies, if it's getting human milk or if it's getting formula. Again, that relationship between food and mental health and well-being is so important. I want every baby to eat and feed well. And I want everybody to get like a little body check, like find your person, find that person that, will help you find a space of rest and well-being. We all need to be in the rest and digest space a little bit more.
Oh, I can't agree with that more. Mm-hmm. Yeah, absolutely.
Well, if anything resonated with you in these 4 episodes that you would like more information about, Jenni she's very accessible. I mean, she's a one-woman show, right? And so if you email her, you're going to get her. You're not going to be getting some big corporation. So if you have any questions at all that have popped up in your brain from any of our episodes, make sure you're reaching out to her. And Jenni, you're also active on social media. Is that right?
I try to be. Again, the one-woman show makes it a little difficult, but I try to.
Okay. And then what is your website?
The website is Jenni Johnson BBB, so breastbottleandbeyond.com.
Perfect. Thank you so much for joining us with all of these episodes. We learned a ton, and I know you guys listening did too.
Thanks for having me.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.